Hello, everybody. This is True Demon, and I wanted to take some time to look over this presentation that Progenity put together for everybody at their investor deck. This was mainly a presentation delivered to talk about their drug delivery system and the timelines for when these are expected to hit the market, and some of the prospects that they're looking at. And these are the main reasons why Progenity is such a good company to invest in for the long term, not just for a short squeeze. um, and I know everybody's a little bit worried currently because the short interest dropped out uh, by a pretty significant margin, but I'm not personally worried about that. There's still enough shares sold short that a short squeeze is definitely still possible. But regardless of any of that, let's take a look at what Progenity had to show everybody. So I'm reading this for the first time with you all. This is this isn't anything that I haven't gone through it. I went to like the second or third slide just to see what was actually in it, but I haven't looked into it in detail. So we're all gonna take a look and analyze this together for the first time. So this is mainly just their disclaimer page. Not really anything interesting here. So this is the main attraction right here for Progenity. And I didn't actually watch this presentation, so I don't know exactly what the speakers talked about in this, but this is I have done at least a little bit of research onto the oral biotherapeutics and the GI targeted therapeutics drug delivery systems, and they're super exciting. Like, this is incredibly awesome technology. So the the short story is that these are basically smart pills which are able to be ingested and deliver specific types of drugs that, in the case of the oral biotherapeutics delivery system, this is one that specifically delivers the drug um, to deliver large molecules that are either destroyed or rendered unusable through the GI tract, or they have to be delivered to very specific parts of the GI tract in order to make them effective. And this is because we have tons of drugs that lose their efficacy as we digest them, and even like certain NSAIDs like ibuprofen is not as effective, and it also is destructive to our GI tract. Like, if you take too much ibuprofen, like Advil or something like that, or aspirin, it can affect the heart. It can degrade the stomach. It can give you ulcers and things like that. So um, all of these all these different types of delivery systems have a lot of really exciting and unique use cases. Um, Specifically, the oral delivery of biotherapeutics is able to deliver drugs that would require a direct injection. So that is particularly exciting. So adalimumab is a type of drug that was developed by, I think this is the one that was developed by that this is Humira. I can't I still can't even spell it correctly. Adalimumab. Yeah, okay. This is the Humira brand. So this is the actual scientific drug name for the molecule. Um, and this is kind of how I do my DD, especially if I'm looking up complex topics. Um, and everybody will probably laugh at me for going straight to Wikipedia, but hey, Wikipedia's got good stuff, and not to mention they do actually cite their sources, so I can always go through all of this stuff. But let's actually discuss very briefly what Humira can do. Humira is it's an excellent autoimmune suppressant and inflammation suppressant. The use cases for Humira or adalimumab is essentially to reduce inflammatory responses in the body that are caused by a immune response. A lot of autoimmune diseases, such as, well, they actually list them right here: rheumatoid arthritis, plaque psoriasis, axial spondyloarthritis, so different types of degenerative bone disease, degenerative GI diseases like ulcerative colitis and Crohn's disease. These types of issues affect tons and tons of people. And this one I didn't even know about, uveitis. This is, I believe, Trades actually suffers from this condition, where he's got a inflammation of the eye that can damage his eyes, and Humira is able to treat that inflammation response. So I bet if you asked him, he'd be able to tell you something about that. So all these different types of diseases, um, they're all related to some kind of an inflammatory response, usually caused by some sort of um, autoimmune condition. So when the body is attacking itself, and down to allergies, can is a, from allergies to Crohn's disease, they're all types of autoimmune responses. And Humira is possibly the most effective drug that's able to deal with this sort of situation, just because it suppresses that autoimmune response so effectively. The only problem with it is that it requires regular injections, I believe on a monthly basis, but it may require more or less applications, and it has to be given intravenously. So it's it's not a fun drug to take, and it requires frequent doctor's visits, and it's pretty disruptive. And also, by the nature of how it's administered, also makes it rather restrictive to who can get it. And then, in addition to that, the amount that someone has to take it can have other effects on the body. Um, it it carries risks of infections, and then there's some speculation that it might make people more susceptible to certain types of cancer. Um, and apparently, I didn't read about this until now. Apparently, it can cause liver injury. So I don't know how true that is, but in any case, um, it's part of Progenity's rationale for creating an oral biotherapeutics delivery system is that more smaller, regulated, and more effective delivery of the drug can result in fewer side effects, and also allow you to take it more frequently but at regular doses. Um, and that makes the drug a little bit more effective and simultaneously causes the patient to suffer less negative effects. So back to the actual delivery pipeline, we see they're already going into they're already past the preclinical stage and going into the early clinical stage, and we actually saw this in their recent filing where they discussed working in partnership with with some unnamed some unnamed benefactor in order to start developing clinical studies so that they'd be able to bring this drug to market, and partner with that organization to create a delivery system that would be effective, and of course Progenity would share in the profits. Since it's specifically a adalimumab variant, it's not guaranteed that it's AbbVie, the creator of Humira, but that's not to say that it couldn't still be AbbVie, since AbbVie does have biosimilar variants of its of Humira. um, so there's several other drugs that are being named here. Ionis Pharmaceuticals, which if I recall correctly, as I read into them, was developing a treatment for certain type of a gastrointestinal treatment. I suspect for Crohn's also. So this was one of the drug candidates that a lot of people have been citing, and I happen to agree, is a excellent um, is an excellent candidate for the for this OBDS system. And after seeing that the clinical study showed excellent results, that this is a phase 2 clinical study that was in partnership with Pfizer, gives me some conviction that uh, between Ionis and um, and Pfizer working so tightly together during their preclinical studies, that this is most likely who Progenity's partner is. And since Pfizer is working on so many different types of drug, including tofacit, I hate these scientific names, tofacitinib, um, considering that we have one other newcomer to the biotech industry or biopharma industry, which already received a significant portion of funding through Pfizer, is also working on a DDS delivery system for this particular drug here, and a adalimumab variant through the GI tract. I think all signs are pointing to a Pfizer partnership in the very near future, the disclosure of which is going to cause at least some kind of reaction in the stock. Of that, we can be certain. So, no doubt they talked about this extensively in the presentation, but this is there's no other drug delivery system quite like this in the world. There's no drug delivery system that's able to deliver medicine that must be absorbed intravenously or through the liver, that can be taken orally. Um, either the drug, either drugs that would be candidates for this type of delivery system, if they were just taken through a classic pill, like a dissolvable pill, they would be almost instantly destroyed in the stomach acid, which is why this is so important. Or it can become toxic if it's injected because it's not properly processed, and cause damage to the liver if the molecules are too large. Um, all of these factors have to be considered whenever you're talking about drugs, especially new drugs that are treating things like autoimmune disorders. So PGN-OB1. Okay, so this one they're talking about Humira. So showed promising initial preclinical data with an average bioavailability of around 15% of IV for PGN-OB1 following a single dose. I have to be perfectly honest, I'm not sure what that means other than that the preclinical data was good. And here they talked about IBD and presumably other conditions like IBS and Crohn's, um, requiring new and novel therapies. I've met a couple people that have struggled with these types of diseases, and I even personally know a GI or a GI registered nurse um, who had to treat these types of patients, and just the daily pain of living with these conditions is just absolutely horrendous to think about. Like imagine if you had to go to the bathroom every single day and then push out a burning coal is how it's often been described to me. And I'm just like, well, I think it's no wonder that most of them choose a colostomy bag instead of continuing to deal with this kind of problem. I would rather have a bag attached to my hip for the rest of my life than have to crap out a hot stone every single day. Interesting. Oh, that's interesting. Okay. So this is a significant chart. The so this is referring to the total global biologics market. Um, Global biologics being uh, biotherapies, um, basically large molecule medicines that have to be administered intravenously. This includes Humira, but it includes other things as well. Let's just research some of these terms. Drugs derived from living organisms or comprised of components of living organisms. So I suppose that probiotics are a good example of this. As just as a obvious example, but there's hundreds of other applications for this. So delivery of insulin comes to mind. Um, Insulin, if you're not familiar with diabetes or the human body, insulin is the enzyme in the body which breaks down sugar in the blood, and it's what allows our body to process the sugar in a healthy way. Um, and we require insulin in order to live. Um, Sugar that accumulates in the blood is extremely dangerous. Um, and also, if we don't get enough, then we can actually our body basically shuts down from a lack of energy, and we refer to that as a diabetic crisis. Um, it causes diabetic ketoacidosis, which is when ketones, which are very large molecules that accumulate um, from the liver, and yes, the same ketones that keto diets often refer to. Ketosis is the result of starving yourself of sugars and carbs, and forcing your body to process fats and proteins. It produces ketones, which become toxic in the body in high amounts. So diabetics often struggle with this, and insulin has to be taken through an injection regularly, like multiple times a day, especially for um, the worst cases of type 1 diabetics. Type 2 diabetics simply have to manage their sugar intake because they still create enough insulin. They just don't create enough of it for it to be as effective, and their body can't self regulate it. But a type 1 diabetic doesn't create it at all, and they have to be given a biologic insulin, or insulin that's either synthetically created or derived from an animal, such as pigs. That's the most popular form of biologic insulin, is derived from pig insulin. The vaccine segment accounted for the largest market share of biologics. And that's also extremely interesting, considering that Pfizer is now the top contender for delivery of mRNA vaccines, with its close runner-up, Moderna. This is an excellent candidate for vaccines to be delivered orally. And imagine how easy it would be to take a pill to get a vaccine. Hell, you could administer it just over the counter. Just go to your pharmacist, be like, hey, I need a vaccine. Great, here you go. Take that pill and you'll be good to go. No needles. And yeah, I'm not saying that that's exactly what's being manufactured or worked on to make possible in the near term, but theoretically, if you could, if you can deliver something like Humira, which has to be absorbed in the blood and processed by the liver, or it has to be delivered to very specific areas of the body, you could certainly deliver a vaccine. You just have to get it past the initial GI tract that would otherwise kill the virus, or kill the mRNA delivery mechanism. That is interesting. So I'll leave this as an exercise for everybody else following behind. But considering that the monoclonal antibodies, made by cloning a unique white blood cell. Interesting. Interesting. I'm sorry for the silence. This is important. So I would say definitely read through this Wikipedia page and follow up on some of the actual references. But monoclonal antibodies, for lack of a better description, at least with my infantile understanding of of human anatomy and biology, are basically clones of white blood cells or similar types of cells in the body, which are able to be introduced and bind to each other and have a effect on another. So um, it's kind of like introducing white blood cells from another person that have been genetically altered or might have been exposed to a certain type of virus, or something of that nature, in order to attack a specific type of disease. And I've heard of this research being done where it was specifically used to treat cancer, where you program essentially white blood cells to attack cancer cells. And I I have to look into this further, but my my inkling, or rather my vague memory, is telling me that that was a very promising area of research for cancer treatment that still has yet to be fully explored. And considering that we're talking about a smart pill that would be able to travel through the GI tract and deliver this type of drug non-surgically, or delivers some monoclonal antibodies to specific areas of the body, would give them the ability to treat very specific types of diseases, cancers, even perform like telescopic procedures or remote, I'm not sure what the term is, but basically cameras inside the body and inspect the body without having to actually cut somebody open. So, well, I won't bore everybody with continuing on with that section, but the this is a very interesting breakdown of the market that this could be exposed to, with monoclonal antibodies making up just barely under half of the total market share of global biologics, and that delivering these antibodies orally would make the drugs or the treatments immensely more accessible. I find that extremely interesting. And take a look at these footnotes too, because these will no doubt have an effect. They absolutely will be important. So this is moving on to the preeclampsia or the precludia product. So yeah, I see they're doing my work for me, providing all the stats. Preeclampsia, it's a blood pressure condition that occurs in pregnant mothers, and number 2 cause of maternal mortality. And considering that the United States has the worst rates of maternal mortality in the developed world, would be extremely significant in the U.S., and it's no wonder that it's a $3 billion market in the U.S. Because preeclampsia screenings are currently, they're not easy to do. Most of the time, it doesn't come up until the mother goes into labor, and at that point, it becomes immediately life-threatening. So, considering that, according to Progenity, there's no single test for preeclampsia to rule out conditions that would lead to it, this would be huge. It would allow mothers or expecting mothers to get these type of rule-out tests just as often as they go to get their ultrasound done. And that would make it extremely accessible, be a great source of peace of mind, and it would also give doctors a heads up of the risks that somebody would be subjected to going into labor. Yeah. Okay, so a validation study has been submitted, and the data will not be available until it's finally published. So once this study, PRO 104 validation study, is published, that will confirm if the product is ready to go to market. Okay. So with the OBDS systems being currently under study, the preclinical data won't be prepared until the end of the second quarter of 2022. The second half of 2022 is when they expect clinical study initiation to begin. And at the moment, they're imminently going to be setting up a device function study in UC patients in the beginning of 2022. So Precludia is the very first one that's getting ready to go to market. As soon as the studies are completed, they'll be able to publish the results and then conclude licensing efforts. So whoever their partners are that are going to help them with going to market with this product, this news is going to hit It can hit it any day, honestly. But once the studies are completed, that's when we'll know, and this one will go to the market. Oh, it looks like that's the end of the study. So, main key takeaways from this one for me have been they've issued timelines for when their clinical studies are going to be started and concluded. They're already working on preclinicals for the OBDS. They are already working on clinical studies for DDS. And Precludia is imminently waiting for publication of the of the results for their rule-out test of preeclampsia. So as soon as that publication goes through, they'll be able to conclude licensing out to their different partners and send it out to market, and that'll become an immediate source of revenue for Progenity, given that it's a $3 billion market according to their estimates. That's huge. That's absolutely massive. Their company is like a $500 million market cap right now. If they could even grab 10% of that market share, that would exceed their entire market cap. That profitability would nearly exceed their market cap. That alone could be that would be earning them $300 million every single year if they could capture that. That would be absolutely that would be monumental. Not even counting that there's a potential partnership for Pfizer, and who knows what other companies. Since they specifically named Ionis, I'm absolutely convinced that they're working with Pfizer, especially all the references made to them. Yeah, I am very eagerly awaiting these disclosures, but I'll be looking for these in the coming days. So I hope that y'all found that informative. Gave you some idea of what to expect coming from Progenity, and see what other catalysts are on the horizon for them and how they can change the face of medicine. Thanks for watching, and good luck in the markets.